Welcome back. A new study is revealing some surprising news about colon cancer in younger adults, highlighting why screenings and regular doctor visits are more important than ever. So here to break it all down for us is Dr. David Emrine, who practices family medicine at Beacon Medical Group, Main Street. Doctor, thank you so much for your time today.
Thank you. Thank you.
This is something that's so important. Help us understand what's happening here. In some ways, there is some encouraging news, right?
Yeah, I mean, we're detecting cancers at an earlier age now, and screening's recommended at age 45. And prevention is key. So we're getting better outcomes, identifying disease earlier, better outcomes, and overall improved survival.
Absolutely. So when you talk about colon cancer screenings, what's your approach? How do you motivate someone to do that? You said the age is lowered now, right?
Yeah, so we'll talk about alleviate stress and anxieties about the preps and procedures, and talk about all the available options.
So that's easy. I know we talk about this. I mentioned to you I had a friend sadly pass away of colon cancer, and she used to always say, okay, the prep, people used to get so worried about the prep. There have been advances in it now, right? It's not as brutal as it used to be.
Yeah, I mean, there's higher volume preps, but there's also alternative preps, lower volume preps, pill preps, things of that nature.
And
so
right, one night of discomfort can also
yeah, and you want to try
out.
to just tailor that to the individual.
Let's talk about some of the symptoms of colon cancer, because a lot of times people don't always love to share about what's going on, but it can save a life.
Right, so you want to pay attention to your body. I mean, most common symptom would be bleeding, obviously change in bowel habits, diarrhea, certainly unexplained weight loss. Talk to your doctor, build trust with your doctor, and talk to your doctor about the problems that you're having.
What if someone is younger than 45? What can they do if they think, hey, I might be a little bit too young? Can they still get that screening?
Sure. Again, pay attention to yourself. I mean, if you're having symptoms, push, and eventually, you'll get the the screening that you need.
Yeah, absolutely. I guess when I mentioned encouraging news, is that more people are kind of on top of it right now. They're interested in screenings, right?
Yeah, I think as those guidelines have changed, I think we're seeing more individuals get screening. So.
And that's huge.
Yeah, oh, yeah, absolutely.
And that is. What is your biggest message about people being proactive with their health?
I think basically just, again, making your annual physical with your doctor and getting the routine checkups, because, at those visits is when we cover all the available screenings.
Yeah, as a doctor too, when you're seeing these younger people being diagnosed, it's hard to pinpoint, I guess, where this is coming from, but that has to be devastating too. It's a terrible disease.
It is, or it can be, and we're just not really sure why it's being identified at earlier ages, whether there's environmental factors or genetic factors, or whether it's the processed foods or what, we're not sure.
No, and so that's why it's so important. You have to stay up to date on your screenings and your doctor visits. Doctor, we so appreciate you being here today.
Thanks for letting me be here.
Thank you. All this information will be on our website as well. We'll be right back.